everybody, my name is Peyton Brashear. Today I will be presenting to you all your target population of a geriatric patient as I'm in the role of a dental hygienist. First, this presentation will give you an insight on what you need to take care of in your oral cavity as you start to age. Being a geriatric patient, you will find that your risk of xerostomia and periodontal disease will increase if you do not take proper care of your oral health. This will be very informative as you are about to learn about the demographics, oral health needs, barriers, prevention and implementation, the Federal Action of Dental Health Act, cultural variations, and the role of the registered dental hygienist as it pertains to your age group. Some questions that I have put together for you to answer by the end of this presentation include: what are the demographics of geriatric patients? What are some barriers to care for geriatric patients? How do you prevent or implement xerostomia and periodontal disease? What is the Dental Health Act? How does culture affect this age group? And what is the role of the registered dental hygienist for when it comes to oral hygiene care for geriatric patients? Demographics of the geriatric patients include patients who are 65 years of age and older. Barriers to care for the geriatric patient include functional and medical status of the individual. This means what type of medication you take and why. Transportation difficulties, meaning can you drive yourself to a dental appointment? Does a caretaker drive you to a dental appointment? Or are you in a facility where a dentist comes to you? Accessibility difficulties, meaning do you use a walker or a wheelchair, which will make the dental hygienist and the dentist have some contraindications to include in their dental appointment. Financial considerations, that meaning do you need dental insurance or do you pay out of pocket for your appointments? Previous patterns of dental utilization, meaning do you come to each and every single dental appointment that you are scheduled to come to, and do you take care of your dental oral hygiene care at home properly? Lack of education, and last but not least, but the most common, is fear of the dental office. Oral health needs for the geriatric patient include xerostomia and periodontal disease. Xerostomia is dry mouth. It can lead to increased caries risk, which is cavities, gingival inflammation, making your gums extremely red, puffy, and swollen, mucositis, halitosis, which is bad breath, and just general discomfort. Periodontal disease occurs when gingivitis goes untreated, and the gingiva, which is your gums, pull away from the teeth, and bone can be lost, and teeth can be loosened or even fallen out. It is a chronic condition that needs constant maintenance to stabilize, and the factors listed above only make this more difficult for the geriatric patient. Tooth loss from periodontal disease over time can mean that older patients have more prosthetic appliances, fixed and removable, than their younger counterparts. Missing teeth, bridges, partial dentures, and full dentures can make oral hygiene extremely challenging. It can also hinder chewing function, which contributes to nutritional deficiencies. To the left, I have a picture of xerostomia. You can tell that the tongue is extremely dry and cracked. It does not show the inflamed gingiva, but it looks extremely difficult and discomforting for this patient. And to the right, it shows periodontal disease. As you can tell, the gums, the gingiva is receding from the gingival margin. So you can see the recession and that there is bone loss in between, as you can tell, between numbers 8 and 9, your two front teeth, there's some bone loss in the anterior region of the mouth. Prevention and implementation for xerostomia includes chewing or sucking on sugar-free candies throughout the day, chewing on sugar-free gum that contains xylitol, using a mouthwash that does not contain alcohol, therefore, because alcohol can cause dryness in the mouth, which is not what you want, and using a biotine rinse. Biotine is a rinse that makes your parotids start working and salivating. Prevention and implementation for periodontal disease, brushing and flossing every single day to remove the bacteria that causes gum disease, which is gingivitis, is extremely important. You should brush and floss twice a day, and if you choose to only brush or floss once a day, you should do this in the evening, and it should be the last thing that you do during the day. Going to your periodontitis that your dentist refers you to for treatment, and to follow the recommendations. My web-based research has given the information that dry mouth affects 30% of patients that are 65 and older and 40% of patients who are 80 years old and older. According to the American Academy of Periodontology, 70% of people over the age of 65 have periodontitis. Action for the Dental Health Act is a federal act that has been across the United States. It is America's vulnerable elderly face the greatest barriers to accessing dental care of any population group. But delivering dental care to the nearly 1.3 million seniors in nursing homes has been problematic. Now, dentists across the country are adopting nursing homes in their communities with the cost of care offset by little-known provision in Medicaid. It's an immediate and affordable solution for nursing home residents. Basically, this act has gone into effect so that dentists can go to nursing homes and provide adequate dental care and oral hygiene instructions to senior living people and elderly patients who are in the geriatric age group who need dental care, who cannot physically drive themselves or have a caretaker take them to the dental office. Some cultural variations for the geriatric patient. So not every patient has the exact same dental conditions, meaning not each geriatric patient has xerostomia or periodontitis or periodontal disease. Conditions vary based off of different cultural backgrounds and diet. Nutrition is a huge part in oral health and oral hygiene health. For example, certain cultures, like the American culture, has a lot of foods that contain sugars and carbohydrates that are extremely cariogenic. Cariogenic meaning that they cause cavities easily. If caries are not treated promptly, this can speed up the process of periodontal disease. So I have included pictures of a burger and french fries, Coca-Cola, and cotton candy. We as Americans eat this a lot, and we are not properly educated on how these foods can damage our oral cavity. It can cause caries and decay, which can lead to periodontal disease. And unfortunately, eating these foods for over 65 years can cause some extreme damage to your oral cavity. The role of the registered dental hygienist is to assess the patient's needs and medical history and apply it to the appointment. Patients that are in the geriatric target population tend to have extensive medical histories and lists of medications. This is an extremely important component to the appointment due to any contraindications that the dental hygienist may run into. Taking their time to ensure that you, and if you have one, a caregiver, to teach you proper oral hygiene instructions, to give you adequate information or recommendations to better your oral health by providing an adjunct aid in case of any dexterity issues. For example, if you were to have arthritis in your wrists, elbows, or fingers, this would be an adjunct aid would be ideal so that you can properly brush and floss your teeth at home. Also, we would offer you treatment options and referrals. Say if you have periodontal disease or referring out to an oral surgeon or anything that you may need, we will be able to refer you out in the dentist. So for ADPIDE means assess, diagnose, plan, implement, evaluate, and document. So for assessing, we would review your medical history, and due to your target population having sometimes an extensive medication list, we would review this and go over this with you and see if there's any contraindications to your appointment, then perform proper intraoral and extraoral examinations, and then we would list findings and discuss with you if anything is abnormal. Then we would diagnose based off of the assessment if any signs of xerostomia or periodontal disease will be addressed to you, if so. For planning, based off of your diagnosis, if xerostomia or periodontal disease is present, we would plan your treatment. For implementation, we would perform proper treatment from the plan, whether that be a scaling and root planing or periodontal debridement, place on the correct recall list, and explain at-home oral hygiene instructions to you, and if your caregiver is present, we would explain it to them as well. This is when we would talk about using the Biotene rinse or the non-alcoholic mouthwash, chewing on sugar-free xylitol gum, or even the sugar-free hard candies to for your xerostomia, and if you have periodontal disease, we'd refer you out. Evaluate, we would refer out to a periodontitis if needed, and we would monitor xerostomia and your periodontal disease. For documenting, we would always document your vitals if anything was done or said at that appointment to prepare us or the next hygienist during your next visit. Also, for legal reasons, documenting is super important, and this is something that a hygienist should never miss. So overall, the importance of oral health as a geriatric patient is extremely important. As you age, the risk of xerostomia and periodontal disease increases, and based off of research and knowledge, it is crucial to go to your regular dental appointments and listen to your dental hygienist as he or she provides proper care to you. Oral health provides for your overall health. Thank you so much for listening to my presentation, Here are my references, and I hope this informs you about geriatric patients and dental hygiene.